Hi, Eric here with another Ilara HMIS pro tip. Today we're going to look at the patient overview in the patient encounter and see how it was built that way and how it works and how we can maximize its use. Good, let's go ahead. We are in the patient's encounter. The patient overview will always be on the right hand side of the patient encounter. This is the patient overview. This is its open state, but it can also be hidden from time to time when we want to maximize on the workspace that we have here on the actual sections. So the first thing we're going to look at is how to hide it and how to open it back. So to hide the patient overview, simply click the hide button at the top right. And now it's hidden. This is how the patient overview looks like in a hidden state. To open it back, we will click on this icon and it will be open. Now, when it is in the hidden state, it will only have the initials of the patient's name. So this is the first initial letter of the first name and initial letter of the second name. And it will have this menu that can give us actionable items like encounter history of the patient and editing the information of the patient. Good. Let's open it up, see what it has. So the patient overview will have the name of the patient to indicate that this open encounter belongs to this patient, so that when we are entering data into this patient's encounter, we are sure that it is data belonging to this particular patient. It will also have additional information about the patient like their gender, age, and date of birth. Then it will also have the tags the patient has been assigned. And here you can also add a tag by clicking on the add tag button. Then it will have these three sections, which is triage, encounters, history. We'll start off with triage. Triage here will bear the last triage taken, even if it is for the previous encounter. As you can see, there is a triage information here, but on this encounter that we are in today, which is the latest encounter, no triage has been taken to indicate that this triage is for triage of the previous encounter, which represents the last day they were at the facility for a visit. Now, if a new triage is to be done today, then it will replace what is displayed here. Then we have encounters, and on encounters it will list 3 recent encounters with today's encounter as one of them. So as you can see, this is today's encounter, and then it will also list the last 2 encounters. Here you can only see some information about the encounters, like the encounter type, the doctor that was assigned that encounter, and the date and time that encounter was started. If you are interested in getting more information about these encounters, or even interested in getting to view the details or summaries of these encounters to get more insights on what happened, then you will need to click on View All. And this will load the encounter history of this patient with now all the encounters the patient has had, sorted with the recent at the top. So this is the open encounter that we are in today. This was the encounter that had the triage information. So if we were to get a quick summary, we will do a view summary and say show all parts. And then, as you can see, this is a quick summary of what happened in that encounter, or we could even click on View Encounter to get the information that were entered in that encounter, as you can see. Moving back, let's explore the next part, which is history. And this will have the patient's allergies, medical or surgical history, and family history. And these will always persist throughout the encounters to indicate that When we enter a medical or surgical history here, it will be something that will always be visible on the patient overview, irrespective of the encounter that you are on, or if it's in the past or in the present. So let's do it practically and add a patient's history here. So we can say add, and then let's say the patient is having an allergy. The patient is allergic to dust. Started same time 2022. And the reaction to this is that they get a nasal congestion, which is moderate. We can add additional comments if we want. If not, we can just leave it blank. And then we save and close. So this allergy should persist across encounters. Let's demonstrate. Let's go to encounters, view all of these encounters, and then we will go and view this. It has patient overview, and on the history it should have the allergy that we just added, which is the dust allergy. Now, why this part is important and why it was built to work this way is that this is a way of entering information about the patient that would be needed across encounters without having to go through the process of locating the particular encounter and then opening up to see the information that was entered. So use this part if you want to enter something like the patient's allergies, medical or surgical history. Let's look at the fields that are here. So we have the condition or procedure, date identified, comments. For family history, we have the condition, relationship, and comments. And that is how you can maximize using the patient overview. And this marks our pro tip for today.